A young man once asked me to remove his nipples. He wrote that he thinks they're unattractive and unnecessary.
Sometimes patients come wanting to restore their virginity, and of course I don't refuse to them.
I don't do really big breasts. On the contrary, I reduce large ones.
What problems do you help to solve?
90% of people who come to us really need help. For instance, when a woman can't find in the store her size or fit into lingerie. Sometimes breasts are very stretched out. As women themselves say, I just roll my breasts into a tube and stuff them into a bra. I'm tired of this. Or, for example, when the breasts are too large. This problem can be solved, but not everyone knows about it. Girls with beautiful figures have to wear baggy clothes to hide this physical flaw, as it causes psychological trauma.
To correct the shape of earlobes, improve the shape of the nose, and perform liposuction, anti-aging surgeries like blepharoplasty, facelifts. I do surgeries like hymenoplasty. Sometimes patients come wanting to restore their virginity, and of course I don't refuse to them. I perform penis enlargement and enlargement of the penis head with hyaluronic acid. I don't lengthen the penis because I consider it a bit traumatic. It involves cutting a ligament, and consequently the stability of the penis worsens. But to do lipofilling, that is, to inject one's own fat, we extract from here and inject there, or to enlarge the penis head with hyaluronic acid. Women get injections in their lips, and we inject into the penis head.
There's a joke, you know, how is God different from a surgeon? God doesn't think he's a surgeon. But actually, fortunately, it's just a joke. We're not gods, we can't do everything. There are always limits to what's permissible. There's always, so to speak, the client's material they come with, from which something can be crafted, like clay. There are always the capabilities of the skin, always a limit to its stretchability. How much can be pulled, how much can be cut, what size implants can be inserted, how much skin can be removed from the eyelids, and whether it's necessary to remove a lot.
In which cases do you advise against surgery?
Well, when there are no indications for the surgery, I don't need to dissuade a patient. I simply don't do what they ask for.
When their desires don't match the possibilities. For example, they want to excessively narrow the tip of the nose. A super small Instagram-style nose, as is fashionable now.
A woman comes for a consultation. Her breasts are sagging, not critically, but still, there are indications for surgery. She wants to reduce and enlarge them. If we just reduce or lift them, the upper pole will still not be filled. That is, the breasts will have a natural shape, the nipple and areola will return to their normal position. But there won't be that push-up effect many desire. We insert implants to fill the upper pole of the breast, and from below we remove excess glandular tissue to achieve the shape and size the woman wants. She asks to have this surgery. I say, yes, of course, it's possible. Then she asks, what if I plan to get pregnant? I ask, when do you plan to get pregnant? She says, maybe in a year or two. Why? Of course not. Of course I dissuaded her. Not from the surgery altogether, but during pregnancy, childbirth, and later breastfeeding, we don't know how the breasts will change.
Sometimes it's just an emotional impulse, a breakup, and a girl is ready to change something. After a while, the psychological conflict passes and she realizes that maybe what she did was unnecessary. It's important to refuse in such cases. In regular surgery, we tell the patient what they need, but here it's the opposite. The patient must convince me that they need the procedure.
What are some myths about plastic surgery?
The most famous myth is that breast implants explode on airplanes. Of course, that's not true. Who came up with this, I don't know, but it's advisable not to fly sooner than 7 days after surgery. only because of swelling and discomfort and some pain after implant surgery when flying at high altitudes due to pressure differences. But implants do not explode on planes.
For example, the myth that fat migrates after liposuction, that it moves to adjacent areas. Like if you have liposuction on your stomach, the fat then migrates to your hips. It's not the fat migrating, it's just someone eating too much. The person continues to gain weight. But in the liposuction area, they gain less than in other areas.
Can I take fat from my husband and transplant it into my breasts? Or can I take my hair and transplant it to my husband because he's bald? Actually, of course, this can't be done because of tissue incompatibility, and antibodies are produced that reject foreign tissue.
There's a myth that breast implants cause breast cancer. It's known that the incidence of breast cancer in the general population is the same as in those who have breast implants. These women undergo more frequent examinations. They come for annual checkups with the surgeon, do ultrasounds. They are more likely to detect breast cancer at an early stage than those who simply ignore their health and breasts and don't get examined.
There's a myth that after getting breast implants, it's impossible to breastfeed. In fact, it often depends on the technique used by the surgeons, on the approach. I use techniques that allow breastfeeding after implant placement, so it doesn't affect lactation at all.
Recall the most unusual request from a patient.
A young man once asked me to remove his nipples. He wrote that he thinks they're unattractive and unnecessary, but actually there are no redundant organs in the human body. Actually, it's such a senseless operation. Aesthetically, it's unacceptable to me.
A client came and wanted to get a piercing. This was about 6 years ago when I just started in plastic surgery. I did piercings. He came and said, I want a Prince Albert piercing. And the thing is, it's a very rare piercing. The urethra on the penis head is pierced and a ring is passed through the urethra opening and hangs down like this on the penis head. It was quite strange, but I did this piercing for him, and the patient left satisfied, never came back. I wouldn't even say it was strange, just unexpected for me. Especially since the patient was 55 years old and apparently he still leads such an active sexual life. So he wanted to try something new, wanted to try some spice.
I remember once a girl came for a consultation. She said she doesn't see herself as she really is. She showed a photo of a girl on Instagram, an Instagram doll with overdone lips, eyelashes, and she said she won't be calm until she changes her face to look like that. Although the girl who came was beautiful, you can become a victim of plastic surgery when the face changes so much from a huge number of operations that it looks unnatural and unattractive. Yes, I didn't do anything for her. I recommended she see a psychologist.
Do patients ask for body parts like celebrities have?
People want buttocks like Kim Kardashian has. They even send me Instagram links sometimes to Instagram profiles of some, honestly, I don't even know these bloggers. But some bloggers have such a waist and such butt, and they want the same. And they ask if it can be done, for example, not with implants, but with fat. And how it was done for her, for example, they ask.
I want to make a nose like a model's. Or I want to make a chin like Jessica Alba's. If I see a picture they show and it really suits them, then of course I can do it. If it really doesn't harmonize with their face, then of course I can refuse.
Angelina Jolie used to be very popular, now less so, but actually it's not a very good request because a body part, like for example the nose, cheeks, lips of Angelina Jolie, those are her lips. You have to fit a specific nose to a specific face.
There was one guy who came and showed me a photo of a completely different type, not like his face, and said, "Make me look like this." Naturally, we parted ways. We talked for a long time about how that photo was not about him at all. I tried to make results as natural as possible. Not always, because sometimes patients ask for a little more than I would like.
the largest breast augmentation you've done?
I don't do really big breasts. On the contrary, I reduce large ones. The biggest is the 4th size, but it suited that girl very well. I never put in implants that don't match the size of a woman's chest.
500 milliliters, an abstract number. That is, on one woman with a wide chest, 500 milliliters will give a 3rd size. But on some skinny woman, for example, 500 milliliters, it will be a 4th or 5th.
Size 3, a 3.5. I generally believe that the bigger the implant, and this is proven by scientific observations, the bigger the implant, the higher the likelihood of complications after surgery. Because the implant is larger, it stretches the tissues more. There's a likelihood that it will sag sooner.
When is liposuction pointless?
Liposuction is useless when a person wants to lose weight with this operation. That's wrong. Indications for liposuction are contour correction.
If a person has excess body weight, liposuction won't help them. Even if you remove 3 to 4 liters of fat, there won't be a significant wow effect.
Fat cells, they don't increase in number, they increase in volume. If a patient gains weight, then in the place where you did liposuction, there are still fat cells. You can't physically remove them completely. And of course, if a person gains weight, then that place also gains weight. It's not guaranteed that it will return to the same level as before the surgery, but it can just change and not be the same as after it.
I did liposuction with a lack of body mass. When a person is proportionate but they still have so-called fat traps, patients call them flank area. For some it's like wings over the chest. Those areas that accumulate fat, genetically, they are programmed to do so more than other areas. And apart from liposuction, there's no way to get rid of it. And if someone thinks you can do liposuction and, as they say, suck out the fat and lose weight, then it's not this operation.
Recall your most memorable patient's reaction to the results.
You can't say it out loud. It was a breast augmentation surgery. And it was the husband's reaction. The patient showed me her phone and says, "Look, he wrote her this word." It was very cool.
I remember a patient, when we removed the cast from her nose after rhinoplasty, she was so happy and said, "Doctor, let me hug you."
The most vivid reaction to the result is when girls literally jump, almost squeal with pleasure. Some hug. In general, very happy. Or after facelifts, I tell my patients that swelling will increase the next morning. Some women somehow don't believe it. They think they won't have swelling, or it will be minor. I remember I had such a woman. The next morning she sat and cried in the hospital room when she saw herself. That is, she thought that this probably happens to everyone except her. Well, by the way, after facelifts, there's often a period of regretting what was done, and then it passes, and then when the swelling subsides, it becomes easier. A little bit of pain syndrome recedes, and the woman is then happy with what she did.
Do men come to you for procedures?
Of course, patients are mostly women. Men also come. It's interesting how different the requests of men and women are. With a woman, sometimes I think the request is just endless. If a woman comes for lower eyelid surgery and you see that she needs upper eyelid surgery, she will always do both. Moreover, she will ask, maybe we'll enlarge the lips, maybe we'll do something else. She'll ask about the breasts, and so on and so on. A man comes with one specific problem. Everything else just doesn't concern him. Men most often come to get rid of bags under the eyes or to get rid of wrinkles.
I work with both men and women, and both come to me. I'm talking about intimate area surgery, that is, I provide services for penis enlargement for men, glans penis augmentation with hyaluronic acid.
Men have come for nose correction and, for example, gynecomastia. This is when men develop a kind of breast tissue. It grows. It can consist of either fatty tissue or glandular, sometimes mixed forms, and depending on this, it can also be corrected. There is also a type of men who are brought in by their wives, for example, to lift their eyelids. It's not their personal desire. She, for example, worked on him for a year, had conversations with him, nagged, and finally he gave up and came. Such men tend to, for example, suddenly fall ill on the very last day before surgery.
Can plastic surgery change a life?
Every patient has their own problem that they want to solve with this surgery. In childhood, someone said something and they developed a self-doubt. Surprisingly, quite often it's the mother who, caring for her daughter, says, "Honey, wear wide pants because your legs are crooked. Wear ruffled tops because your breasts are small." Yes, in this case, of course, you can work with a psychologist, and I tell patients about this. And in general, people come to us who don't want to work with their head and mental health, but who are ready to have surgery. And perhaps this is even cheaper for them because working with a psychologist can last many years. And I know that these people, having done one surgery or another, they just get rid of this self-doubts. And their lives just change for 100%.
A girl buys herself a new coat, and of course, she strives to tell everyone about it. She enters a group and shows off in front of others, and it gives her emotional satisfaction. The same here. If a patient changed something there, did something for herself, enlarged her breasts, then she feels more confident in herself, if that's what she wanted.
Many people have these problems in their heads. Someone doesn't like their nose, although those around them may not pay attention to that nose for 100,000 years. But this girl, she solves this problem. She starts to like herself first and foremost. Her eyes start to shine, and she becomes confident in herself. And accordingly, she starts to please other people, because here she is, all inspired, uplifted. She's happy.